Welcome, everyone. Thank you so much for joining today's webinar. In case you don't already know who I am, my name is Kimberly Brunel, and I am the Support and Education Programs Coordinator at PHA Canada. I've only been here for, I think, just over 3 months now. I bring to this role several years of experience in health promotion and patient support. I'm really looking forward to the opportunity to meeting all of you from the PH community and to getting the opportunity to lead some initiatives that are going to impact your lives. And I'm really excited about leading today's webinar entitled Cultivating Resilience in the PH Community. So we're going to go over some of the slides, and then we have a panel that will join us later, and then an opportunity for all of you to share your thoughts with us. So I'll get started with the slides. There we go. There we go. So for today's session, like I just mentioned, we'll begin by reviewing some of the results from PHA Canada's PH Community Survey. And then we will welcome a panel of speakers to join us, and we'll discuss the theme of resilience and how it appears in our lives and within the data of the survey. And then following this panel discussion, I'm going to open the floor to all of you for an opportunity to ask questions or share your stories of resilience. So to give you a bit of background, back in 2013, PHA Canada's Burden of Illness Survey was carried out. Its report has really been a crucial tool for educating decision makers on the complex needs that are faced by families affected by PH, and has been a really powerful advocacy tool for many years now. Now, to better improve patients' and caregivers' quality of life, PHA Canada decided to conduct a follow-up PH community survey in 2021, so earlier this year, to measure the changes in how people are impacted by a PH diagnosis. We also wanted to look at things such as the quality of connections between people affected by PH, looking at current treatment options, attitudes towards current or potential treatment options. What are the priorities for educational and support resources? What are our community demographics, and so on and so forth. And the purpose of this survey really was to measure the physical, social, financial, emotional, and psychological impacts faced by the Canadian PH community. And as well, we wanted to capture some data that would help us evaluate our 2021-24 strategic plan. So as you all know, we conducted this survey just over a year into the COVID-19 pandemic. And I think I can speak for definitely myself and some of you when I say that this time has felt like the longest and most extraordinary time in our lives. It's just nothing like it. And as we began to dive into the survey results, we could most certainly see the effects that the pandemic was having on the community. And on the slide here are just some of the results that I'm talking about. And sadly, as we all know, we're very much still within this pandemic, and sadly, it'll be with us for quite some time to come. On the other hand, what stood out so brightly to us was that amidst the challenges faced during this unprecedented time, the community really has adapted and has demonstrated resilience in the face of adversity. The survey revealed to us that although the past few years have been difficult, the PH community has adapted and is focusing on the positive. If we look back at the Burden of Illness survey, the results of that survey showed us that living with PH already requires a great deal of resiliency. So this concept is not new to us in any way. The added risks of living with PH in a pandemic means that Canadians affected by PH need to cultivate resilience more than most people. So in a sense, people with PH were more prepared than the average person to cope with a pandemic. We already had some of those tools in place before the pandemic hit. As we continue to move forward as a community during the pandemic, we're all going to continue to need to learn from one another. We've done a lot of that already. And we thought, what better tool to master but the power of resilience? So it's for this reason that we chose the theme of resilience for this year's PH Awareness Month. We saw it as an opportunity to learn from others and to learn from the community on how we can continue to be resilient in the coming months and years as we come out on the other side of this pandemic. We're going to need to continue to be resilient and find innovative ways to cope with stress in this sort of ever evolving landscape of the pandemic. And so today, I really like to tell you a story about the PH community, and it's a wonderful story of resilience. So what is resilience? We've been talking a lot about this word, and it can really be defined as the ability to adapt to difficult situations. So when we look at our 2021 survey, we asked you all to tell us what were the coping mechanisms that you used to help manage stress and to face adversity. Many of you have filled out the survey, so you might remember this question. And I'm now just going to share with you some of what you had to say. The community's responses were categorized into these main 4 headings. So if you recall, it was an open-ended qualitative question. So it was a spot in the survey where you could just type as much as you wanted. And some of you wrote a lot and some of you wrote a little, but it was all so interesting. And so we took all of what you said and we coded it, and it sort of fell into these main 4 headings. So keeping in touch, taking care of ourselves, keeping our minds, spirits, and bodies strong, and focusing on the positive. So let's dive into each one of those. I just see something in the chat. I just want to make sure that everybody's okay. Okay, perfect. Just some hellos. Super. Okay, so the first one is staying connected. The importance of building strong relationships, keeping open dialogue and finding support within various communities was listed as by far the most important coping skill by respondents in the survey. This was overwhelming. So many of you listed that connecting with others was such a big, important part of your resiliency plan. So the quotes that are on here are directly from the survey responses. So talking with someone who has the same illness as I do really helps a lot. Talking on the phone, we had a lot of, Zooms, going to parks to meet people, being outdoors, talking to spouses, husbands, wives, families, friends, all were listed as important. Keeping me connected to God, my faith, and really support within the PH community were all some of the key pieces that came out. Throughout other parts of the survey, we saw evidence of the importance of these connections. So almost half of respondents reported that they had a good or excellent connection with their peers in the PH community, which was great. So this is a quote from the survey as well. Having the support of others going through the same thing has been so helpful. I wish I would have known about this or other supports years ago. 82% of Canadians living with PH reported an improved quality of life due to the positive relationship and support of their caregiver. This was, again, across the board throughout the survey, the important role that the caregiver or relative, husband, wife are playing in the care, and many of the patients reported this. 2/3 of respondents indicated that they knew where to find support services if they were required. So if they did need to find support, most patients or caregivers knew where to find it. But I think there's still a bit of work that we can do there. According to the survey respondents, we asked you who your most effective sources of emotional support were. And here's how you ranked them. The PH doc took top place with respondents, followed closely by family and nurse. And when I was combing through the data, I came across this quote and it just made me chuckle, and I had to put it in here. But this person's saying, can I say PH nurses again? Like, seriously, those women are everything. Throughout all of the data, not just within this one question, but throughout all of the questions when there was an opportunity, so many of you took the chance to highlight and really give shout outs to your PH team. For me, it was so wonderful to see that the community has such a wide variety of sources of emotional support. Rest and relaxation were definitely on the top of many respondents' lists. So this included things like practicing good sleeping habits, mindful meditation and yoga practices, and other practices such as Reiki or Tai Chi, deep breathing exercises, and really just a simple recognition of knowing when to slow down and take a break. And I thought that was really meaningful. I saw a lot of that, just like the one here, simply going back to that, just recognizing that I need to stop, deep breathing exercises, lots and lots of rest, and just knowing when it's time to stop. Self-care, it can often be described in terms of something that's physical, like remembering to take your medications, resting when you're tired. We often look at self-care as something that we do for our physical being. But what what was in the data was really that it wasn't about that. It was about the importance of including mental wellness and finding social supports and help. That was really the definition of self-care for the community, which I thought was really interesting. Respondents shared their self-care priorities, which included seeing a psychologist, counselor, therapist, social worker, expressing their emotions through crying, laughing. There was a lot of responses. I scream, I vent, I talk it out, I cry, I put on a funny movie just so I can laugh for a while. Putting thoughts to paper through journals and other writings, taking time for themselves, watching your favorite show, whatever's a lot of Netflix, or, binging some stuff, and taking long baths. In addition, 1/3 of respondents shared that they had accessed mental health services as a result of their PH diagnosis. And I felt this was important to mention because I think it really does demonstrate that the PH community is very clearly prioritizing their mental health and are recognizing the importance of self-care, especially during this time of pandemic. So it can be really difficult to participate in a regular fitness program when you're affected by PH. But aside from staying active, that was sort of the number one thing that came out of the results. This seemed to be the number two. It was really evident that the PH community wanted to move just in whatever way that they could. Respondents talked about the importance of walking, being in nature, lots of walking my dog, lots of pets. People felt that their pets were really important to them. Biking, doing fitness videos at home, practicing yoga, any way to keep moving. And I think what I found interesting here is really, staying active isn't just about the physical, getting physically stronger or endurance or building muscle. What it really is, it's about stress relief and to help support our mental health. And that's a lot of what you talked about in the survey results. As we saw in our recent summer issues of Connections, the PH community is a really very creative group. And there was a lot of this within the results as well. Activities like sewing, jewelry making, poetry writing, painting, knitting, singing, puzzles, coloring, music. They were all listed as coping strategies for the PH community. Slowing down to reflect on an art piece that you're doing, or focusing on a really tough jigsaw puzzle. It allows us to calm our minds and focus on something other than, the pandemic, or, sort of whatever else may be bothering us that particular day. And I think for many, simply staying positive and focusing on what they can do rather than on what they can't do was an important part of their daily lives. Taking things one day at a time, feeling grateful for each day, and focusing on the positive are just some of the ways that the PH community are staying resilient. And there's a quote here as well that I pulled from the survey. Life is good, even with PH at the moment. I make the best of each day and live life to the fullest. And I enjoyed the last part, except for the present limitations with the COVID-19 pandemic. I think we're all trying to, live our lives to the fullest. It's definitely difficult to do in pandemic time, but I think the survey results will showing that we're all trying to do that in the best way possible. So I'm going to move into our panel discussion, and I'd like to welcome our 3 panel members to join me to discuss these results and the topic of resilience. So if I can get you to turn your cameras on, I'll turn mine back on as well.
Hi, Kimberly. I also have Tarja here with me.
Super.
Yes.
Hey, Tarja.
Hi.
Oh, that worked out beautifully.
Yeah, it did.
Oh, great. So I'll highlight that our three panel members today are not only PH community members, but they were also members of the advisory committee that helped to draft and put together this PH community survey. So they know a lot about it, and they're just excited as the rest of us to hear more about the results. So I'm just going to introduce them each very quickly. So Joan's daughter was diagnosed with severe PAH in 2014 at the age of 24. Joan has been an active advocate since the diagnosis and is currently a PHA Canada ambassador. Welcome, Joan. Initially, her goals were to better understand the disease, the available treatments, and the potential new treatments that might be on the horizon so that she could advocate for earlier and equal access to all available treatments. But this has morphed recently into a broader goal of advocating for changes, including greater patient participation in the rare disease drug development approval and funding processes in Canada. So next is Lisa Lee. Lisa is a nurse practitioner at the Vancouver General Hospital. Lisa facilitates urgent referrals for pulmonary hypertension and treats pulmonary hypertension patients both in the ambulatory care and hospital settings. She developed and coordinates the genetic testing program for familiar PH, idiopathic PAH, and pulmonary veno-occlusive disease. Lisa was integral in establishing and continues to oversee an effective counseling program for patients struggling with pulmonary hypertension. She's a member of the Canadian Pulmonary Hypertension Registry Steering Committee and is responsible for overseeing the clinic database. She has been a member of the Canadian Pulmonary Hypertension Professional Network since its inception and has been a repeat member of the executive. Welcome, Lisa. And Taria. Taria Morel was diagnosed with PAH in 2012, shortly after the birth of her son. Since then, she's been involved with PHA Canada as a staff, as a patient ambassador, and as a volunteer. She works in health systems research and is happy to have the opportunity to lend her skills to this important work. Welcome, Taria. So glad you were able to join us. That worked out well, didn't it? And I apologize, I'm struggling with a bit of a cold, so I apologize if I'm sniffling or if my voice is hoarse. So I want to dive right into our chat. I'm going to stop, maybe I'll stop sharing my screen and people can just see us for a bit. There we go. So I actually wanted to start our chat with something that you said, Taria. I don't know if you were all able to catch Taria on Monday with Dr. Weatherall. They did a Facebook Live talking about the survey. It was fantastic. And Dr. Weatherall asked you, Taria, in that interview about resilience and how you define resilience. And as I was listening, I started jotting down what you said because I thought you were saying it so much better than I was saying it to myself. And I'm just going to repeat some of what I wrote back to you. You had said that it's not a character trait. And that's often how we define it, as you are someone that is resilient. And you're saying it's not that. It's something that can be practiced and built. And you said that it looks different for everyone and everyone does it differently. And I wrote that down feverishly as you were saying, because I was like, yes, I think that's what I've been trying to get at when we're developing this webinar and going through the data and using resilience as a theme. It was really about the fact that this isn't something that you have or you don't. This is something that everybody can practice, and we can all learn from each other as to how we are building resilience in our own lives and continue that work on our own. So I wonder, maybe you could start off and talk a bit about how you see resilience.
Yeah, I think, today's a really interesting example of that. So today I had planned to be at home, be on this panel and do my regular thing. And then this last minute appointment came up for a scan I've been waiting for a while. And, I think part of resilience is being really intentional about going with the flow and just rolling with it when things come up. Because I think for people with chronic illness, things come up a lot more often. And I think it's very tempting to get stuck in an idea of should, like this should be the way it should go, or this should be how my life should have gone. And if we get sort of stuck in those thoughts, it brings you down a really negative path. And it's sort of this very hippie kind of Buddhist idea of just letting go of all of that and just experiencing what is and trying to find the joy in what is. But the more you do it, the easier it gets. And the more you do it, the happier your life in general becomes, even with all the random things that come up. So you're like, yes, my plan for today didn't work out how I wanted it to, but now I get to sit with Lisa, which is kind of cool. Not being in rooms with people forever is a thing. So now I get to be in a room with a person. It's kind of fun.
Yeah. And what about you, Joan? How would you define resilience?
I'm not sure how I would define resilience, but I know when I see resilience, And one of the things that has always amazed me about the PH community was resilience. I remember when Brooke was first diagnosed, she didn't want to attend conferences. She didn't want, because she was concerned that when she went to a conference or a support group, what she was going to see was sad, and what she was going to see were people existing with a disease. And in both instances, both support groups and in conferences, really, when you go, what you see are people thriving. I mean, these are, a lot of times you don't even know the patient versus the caregiver, because there's no sadness. There's like Taria said, there's joy, there's laughter, there's to me, it's an amazing, it's for people who for caregivers, it's actually it's kind of refreshing, or it puts a different dimension on our lives as well, because we can see that people who are coping with disease and being resilient and living in the day and finding joy, it kind of makes you as a caregiver, somebody as well who goes, wow, that's where we need to be. That's where I need to live too, because that just seems to be a much better place than worrying about what's going to happen tomorrow. I'm going to live in the day. I'm going to enjoy the day. And I'm always amazed at the resilience of patients.
And what about you, Lisa, from your lens, how do you see resilience playing out, especially in your patients?
So, I mean, first of all, I just want to thank you guys for including me in this incredible conversation. I mean, I'm going to do my best to stay completely calm through this, but this is obviously a very poignant topic, because, I've worked with a lot of patients over the last 10 years in this field, and there's a portrayal of in certain communities, and again, not in this community, that healthcare providers are drug pushers, or they have their own agenda. And you guys have all spent a lot of time with us, and you realize that that's not the case at all. We prescribe drugs, we make diagnosis, we order tests, because in the end, what we want is for you to live, right? We want to see these things, these beautiful things where people are creating art, where they're living their life, where they're connecting with their family and with their peers, looking for improvements in quality of life. And it's really interesting, looking across the spectrum of patients that I've treated over the last decade, what characteristics mean that somebody is going to do well with the disease, or some people are going to struggle. And I think resilience is definitely one of those pieces, the ability to cope with what life's handed you, and to turn it in your life into something meaningful despite this impressive diagnosis. I think I'm going to hold it there. I have a few other thoughts I want to share, but I'm sure you have other questions as well.
Sure. So Tari, I'll move over to you. I wondered how do you relate as a patient to some of the messages that I just shared in the slides? Do any of those stand out to you, or do you find that some of them speak to the ways that you practice resilience?
I will admit that my appointment took longer than I had anticipated, so I showed up a little late. I have seen some of the results though, and I think I came in right around sort of the exercise and the art pieces, and I'm so glad that we reached out and got ideas from different people, because there are things in there that are validating for me as a patient. The e-bike thing, I've been trying to talk myself into buying an e-bike for the longest time. It's going to be a great way for me to get around, because I'm intimidated by the idea of getting too far away from home and then not being able to get back. And I think e-bike would be a great solution for that. But yeah, definitely, none of these I think are terribly new ideas. We all know that diet and exercise are important. That's not a new idea. But I think hearing how people are actioning that in their lives is really helpful. And just as even a reminder for ourselves, for hey, this is something I could be paying attention to. Music. My counselor, so Lisa had set up that counseling program, said in the bio there. And the counselor that I speak to there has always been very much an advocate for just have music on in the background all the time. It's something that's a mood lifter that's easy, and it's true. So yeah, being able to see those pieces, remind myself of them, I think it's always helpful. I think once this comes out in like a publishable form, it's something I'll probably find a piece of to tack up on my bulletin board or something, just to have like a visual reminder of the things that I can be doing when my mood is down. Because I think, and I said it when I was talking to Jason, but I think it's worth reiterating. Being resilient doesn't mean you don't get sad. It doesn't mean that you don't struggle. It's about recognizing it when you're in that place and being really intentional with how you want to be feeling instead of how you are feeling, and recognizing the bad feelings. It's not about stuffing it down. That's horrible. But recognizing it and trying to find other ways to shift your perspective.
Yeah, I like how you put that. It's true. In the results themselves, it's not like everyone was being positive. There were definitely a lot of comments of people that were struggling with the idea of resilience, and even were able to suggest one thing that they would do, and others who definitely appeared to have more of an ease with it and had more practice with it, and were able to sort of list a number of things and look at things from a positive perspective. But it is something that you have to continue to work on and build on. And Joan, from your perspective as a caregiver, because these results were a combination of both the patient and the caregiver survey, do any of the messages relate to some ways that you practice resilience?
Again, not so much myself, but I'm going to follow with something that Taria just said. I mean, the reality of it is, there are days where it is a struggle. Sometimes it's a struggle to get out of bed. Sometimes it's a struggle to deal with medication. Sometimes it's a struggle to deal with side effects. Sometimes those days go into weeks, just depending on where you are in your journey. And I think it's one of the things that we've learned, and I'm speaking for myself as well as for Brooke, is that, there are ups and downs, and you're allowed to feel down. You have a good reason to feel down, but this too shall pass, and hopefully sooner than later. And we're going to live today and work through that until it passes, and then we'll be good again, and we'll be on the upside, because that's just around the corner.
Mm-hmm. As I mentioned when I introduced you all, that you are all creators of this survey. You all have a big hand in creating it. How do you feel about the fact that resilience was chosen as a big theme that came out of the survey results? And whoever wants to start on that one.
I'm ecstatic about it. I think I had a lot to say about resilience when we were talking about survey development, and I'm really glad that it resonated for people.
Yeah, absolutely. It's very exciting. I really love this area and this interest, and again, the seeing people thriving despite your challenges is honestly, it's one of the biggest inspirations in my life.
Yeah, and I think I'd have to agree with that. And I think the other thing too is, what the teaser of these insights is that we know that, as Taria and Jason had said in the Monday webinar, there is so much more information that is in this survey, that's embedded in the survey, that we will get as an organization. PHA Canada will have so much information that they didn't have before on all kinds of things, and resilience, I think, is, from a patient perspective, probably a really good place to start, because it kind of brings you back to the hope and of what lies ahead in PH treatment and research. Mm-hmm. Resilience.
Yeah, just build on that just a little bit. I think one of the things that I really like about resilience and some of the bringing these ideas together, there's a lot about, especially when you're newly diagnosed, but I think throughout the journey, that feels very much out of control. So it's not within my control what's happening with my disease, what the side effects are. There's certain things that we can do here and there to try and help, but it feels very much out of my control. But these are things that I can do. And I think that's really powerful, just to have some ability to affect my world.
Mhm. Yeah, and I think I've always felt that that's why topics like exercise, and we had that specialty meetup on November 6th, and there was a real interest in talking about some things that I feel like are in people's control, like exercise, nutrition, and things like that, where those are things that you can actually control yourself in ways that you can feel better, or it takes some control over how you're feeling. And so I always find those topics interesting because it's that part of control that I find interesting. And Joan, you got me thinking about the survey overall. So I'm curious to know from all of you, you were all integral in creating this survey. What are you most excited to learn about outside of resilience, obviously, but what pieces are you most excited to learn more about? Lisa, do you want to start? That's a hard question, I realize, because there's so much in there.
I don't know, that's a tough one. So one of the things that we've been looking at is trying to link the information that we have in the PH registry, so the large registry of PH and the survey itself. So I think for me, the most interesting thing will be trying to intersect those two. So, it's interesting that the survey is like one level of data, and then the registry is another level of data. And when you look at research these days, or governing bodies such as the Canadian government or Health Canada, or drug coverage boards, they're so interested in quality of life right now. And what this survey really has done has taken, a lot of drug coverage and prescription choices or treatment choices were based around things like physical things, like walk tests and heart catheterization results and survival, and obviously those are very important, but I really love these other pieces that kind of add some color and some depth and some humanity to the data, and I think that's really what the survey does. So I'm super interested to see how those two are going to kind of intertwine and see whether we can make our knowledge of pulmonary hypertension a little bit more rich, a little bit more of a human context.
Okay. Tari or Paula?
Oh, yeah, no, I'm just gonna tie into what Lisa said. For me, that I can hardly wait to see how that information comes out, and what it says, and what it means to the advancement of the PHA registry. I just think the reality of it is, like Lisa said, the patient perspective and patient choices are going to be, people are looking at, like, agencies, drug agencies, the government, they're all looking at how we get more patient, especially in rare diseases, how we get more patients involved, or patient information included in the decision-making process. And what the survey has done is we've asked those questions. We asked quality of life questions. We asked, what was important to patients? Is it your quality of life? Is it the control of your symptoms? Is it your life expectancy? We asked, are you interested in being a part of a registry where information can be used to advance research? Are you interested in providing blood samples so that we can do some really deep diving work on genetic mutations and things like that, so that research can be advanced? How do you feel about being involved in clinical trials? All of these things are just so, they were never questions we asked on the 2013 survey, and it just brings a whole bigger patient perspective to the information that PHA Canada can use, again, as you said, in terms of where the strategic direction of the organization, but also in terms of advocacy for patients, because now we have more patient information directly from patients.
And Taria, anything that you're looking forward to from the survey results?
Yeah, I'm really interested to hear about people's experiences with COVID-19. I know it's been the most significant thing that's happened in my life for the last couple of years. And it was a pretty unique struggle for, well, I don't want to say unique because there's folks with rare disease all over the place that are living with these kinds of issues, but it's definitely impacted us hugely. So I'm really curious to hear about those experiences from people.
Yeah.
So I'm gonna cut in real quick. I don't know if you talking about COVID-19 and resilience at any other point, Kimberly.
No, go ahead.
Okay, excellent. So as part of my preparation for this, I was looking at the resilience literature that has been published in pulmonary hypertension. And interestingly enough, there was a survey done or a study done in Germany about how pulmonary hypertension patients in Germany coped with the COVID pandemic.
Cool.
So what's interesting is that when you compare it to somebody who's healthy, so what they do is they take a bunch of measurements. So they look at quality of life, depression, anxiety scales, those kind of stuff. They evaluate a healthy control. So the perfect example would be Taria and I. We're around the same age, you know, but I don't have a rare disease that forced me to kind of, I self-isolate, shut down my life, make very serious life changes. Absolutely, I had to do those things. Everyone did from the pandemic. But there's a difference in the consequences, you know, if I was to make a choice that wasn't smart, let's say. And so what that study showed was that patients who have pulmonary hypertension experienced more sense of isolation, higher mental health issues, higher stress levels than someone with a healthy control. And so, again, I don't want you to take something negative out of that. What I want to do is, you know, really validate your experience going through the pandemic and really, like, this is a different country, same population, people going through the same experiences for you. If the pandemic has been very hard for you, you know, be extremely kind to yourself. This is not a failure of yourself. This is the circumstances that you're in. So beating yourself up because you had a hard time or you weren't functioning great during the pandemic or you really struggled, just know that your peers, both in Canada and around the world, also had that experience. So again, be super kind to yourself. This was a rough time. And if you had pulmonary hypertension, it probably was rougher than the average population. So just be super nice to yourself.
Oh, thanks for that, Lisa. That was great. Oh, interesting. Can you share that paper?
I sure can.
Oh, super. Thanks. And as we've been going through the survey data, it's always in the back of my mind that we've asked COVID specific questions in the survey, but I feel like the effects of COVID are within all of the responses in the survey. So every question that we've asked, it would be interesting to look at the results outside of a COVID time. So as I'm looking at all the answers, I'm always thinking they are very very disease specific, but COVID is impacted everything in our lives. And so I'm always very curious to see, I can't see that, there's no way to look at it, but I'm curious to know how much of that impact is in there as well. So it's interesting that we did this survey right sort of within the first year of the pandemic. So there's a lot to take away from that perspective as well. I'm going to wrap up with one more question and then we'll get a chance to talk to those that are with us today. But I did notice as we were going through the survey results that there were, like I had mentioned before, a lot of folks who did have a lot of examples of resilience and were able to share that. But there were a lot of responses from people who simply did not have an answer to that question and didn't know really what that meant for them or where to start. So what message would you give to somebody who doesn't really know what that place is for them, and where would they start at finding resilience in their own lives? And anybody can take that one.
I mean, I think that the results of this survey, when it comes out, and like I know there's going to be publications and connections and things like that, having something in your hands to look at, a list of things for you to try, is going to be really useful for some people. And I think especially those people who couldn't think of a thing or more than one or two things on their own, who aren't in that place. And so my suggestion would just be to try things one at a time and see if they work for you, even if it feels silly or you don't think you'll like it. It's worth a shot. I know in the pandemic, I took up paint by numbers, and it's like the least skill requiring activity ever, but it's super calming. And it was just really lovely to put a brush on a canvas, even though I'm not artistic at all. So just things that you think might be kind of out of your bailiwick, you might actually really enjoy. So just give it a shot.
Again, I would say start small. Don't add this to another list of tasks that you already have in your life. But if you have a free moment or carve out a free moment, absolutely, try and take a step, take some time away from, the more pressing things to try to create some value and some meaning in your life.
Yeah, and I would think I think the place to start, if we could get a list of things that some of the survey responses, that other patients are using or have used to develop and improve their resilience. I mean, until we have that information, or if we can get that information for patients who couldn't provide things that they do to cope. Sometimes why you can't provide something is because you don't even know that you are coping or what you're using. You're just doing it. And so maybe, if there's a list of things that other people are doing, you can go, oh yeah, I did that. Like, of course I cope with that. But there's, like Taria said, there are other things on the list that you might just go, oh, I never thought of doing that. Let's try that.
Yeah. My hope is that people are, who are watching saw themselves in a lot of the examples that were given. And like you said, Joan, are like, oh, I do all those things already. And maybe we're, like you were saying, Lisa, were maybe beating themselves up that they weren't coping very well, but are actually doing a lot of the things that they can do. And that's the best that you can do is sort of practice what you can. And I like the idea of trying new things, and if you don't like it, then just try something else. Mm-hmm. Yeah. I will say, we are going to be giving out more pieces of the data. I know that we're going to get some questions about that, but look for winter connections issue. We're going to have a special feature that will be strictly on the survey results, and Lisa and Joan are writing some pieces for us on it, and so are some other folks, and we'll be giving as much of the data as we can in there. In the new year, we'll hopefully be able to host some smaller webinars like this, where we'll be able to share sort of pockets of the survey results as well. And then we're also working on an executive summary. So there's more coming. I think we'll work on that in the next couple of months. But in the new year, you'll definitely be seeing a lot more of the survey results coming from us. So I know you're as eager as we are, and I'm excited to share it with all of you. So thank you so much. Any final words before we open it up to the floor? Okay. So if you have any questions, folks out there in webinar land, it's so weird that we're just talking to each other, but I know there's so many of you out there. Usually I'm so used to meetups where I can see all your faces and we can chat. But if you have a question or just a comment, or if you actually want me to unmute you, I can do that too. If you just want to kind of come into the chat, there's a raise your hand. There should be a little hand down there. You can put it in the chat that you want to be unmuted, or you can just raise your hand. Or you can write in the chat box itself. I see Diane's got her hand open. So Diane, I'm gonna just see, there we go. I'm gonna unmute you so you can chat. Okay, let me see here. So Diane, can you unmute your line? I've unmuted you on my end. Maybe that's not gonna work.
Don't tell me you've been seeing me all this time.
No.
Have you been watching me cry tears, Lisa?
No. No, you're a nice.
Oh my goodness, I thought I was in my misery all by myself, as usual.
Hi, Diane.
And here I am trying my best because of this, me and my professional way of doing Zoom and all the rest of it. I'm sure it's prime, as far as computer. And here I am, caught with my pants down again. And I didn't have my hand up, but here it is.
Oh, it is.
Oh, I can't see. And I can't see me.
We can't see you
either. That's even better.
Well, since we have you, Diane, is there anything that you wanted to share while we have your line open?
Oh my goodness sakes. I'm embarrassed.
No problem. It's technology. It looked like your hand was up, but that's okay. If you have nothing, we'll just, your camera's not on, by the way. We can't see you, so don't fret.
Oh, you see, I'm stuck. And this is what pH has been for me at this point. Being older than a lot of patients, you know, here I am. This has just been, it's so nice to have the old family back again. And here we are with new information, folks. I'm not miserable anymore. Isn't this going to be a treat?
Beautiful.
This is honestly such groundbreaking material. And the thing is, I've been walking it, but feeling absolutely miserable. Now I can find ways to be really, really cheery. Hey, you guys, we really are on the right track. Go on us. Honestly, I just don't know what else to say. I'm just sitting here crying because I'm just so relieved. And you know, me and my tears, they don't come often. Anyways, this is just so exciting. I'm sorry, I'm just like a kid with a candy. And I just love you guys like you wouldn't believe. And I'm never, this is so exciting. Talk about family, and it just it's just exploding. And only being in this family for 7 years, I just feel like a mountain I've just gone through the mountain. It's been unbelievable. I'm just vibrating. That's all I can say. And I'm back. So that's enough for this kid for now.
Thank you, Diane.
Sorry
Thanks
for the
so much.
explosion, but I just can't believe we're all here on this little box. I just want to hug you and I can't, and that's my problem.
Yeah.
All right, in a nutshell, thanks so much.
Thank you,
And,
Diane.
I'm sorry for the stage.
It's fine. Thanks so much. And I'm so glad that you accidentally had your hand up.
And thanks. Hi, Kim. I've never met you.
No, it's nice to
Sorry.
meet you, Diane.
You're in trouble now.
I like trouble, so that's okay.
Okay, thanks.
Thanks, Diane. I'm going to mute your line now and we'll
Sure.
see if anybody
Please.
else has anything. Here we go. Okay. So I'm just going to, if I see any other hands up, I'm happy to unmute. I don't see any others, but I see some chat coming in here. So Jazz is saying, I found buying myself a new laptop and learning Zoom has helped a lot through the pandemic, and being in my granddaughter's bubble is what got me through. Love seeing the pictures of your granddaughter on Facebook, Jazz. A lot of classic Diane, so I guess we're all, that was pretty funny. Let's see, trying to look through all the comments. Thanks to everyone. Great. Anything in the Q&A? There's a question in the Q&A. When talking about resilience during COVID, heat domes, fires, and now floods, yes, everything happening out west, and other challenges, is there a place to share the issues that can be overwhelming but not directly related to pH? It's a great question. So is there a place or opportunity for people to share things that just aren't directly related to maybe their pH itself? I think our Facebook page, the Canadian Friends page, or some of the pages are a great place to do that. A lot of people post about things that are not at all necessarily related to pH, but just about their daily lives. And I think that's a great place to have community and to talk about some of those things. Any other suggestions?
And I think even like those of you who are using the counseling services for pulmonary hypertension, you don't have to talk about pulmonary hypertension. If you're having a problem with something else, you 100% are allowed to talk about whatever you need to there, because we know that like survival and quality of life is more than just your disease. There's a lot that you guys are dealing with in your day-to-day life.
Yeah, I can attest to that strongly. If you have access to counseling, use it. It's super helpful. Also recognizing that not everyone has that access, but if that is something that you have access to, I very often talk about things that are unrelated, but at the same time, I think the way that our lives are largely structured around these challenges. Like even if it's not something that's directly pH related, it often has a pH component within it, because my struggle with it often is impacted by my energy levels or whatever. So yeah, don't feel guilty about coming to your counselor about something not pH related, even if it is supposed to be about that.
Amen.
And Catherine saying, being diagnosed on the eve of the pandemic, yikes. I was so glad to find this group of people. Like Diane, my PH buddy, I found this group to be a huge extension of my family, and I love you all. Lots of hearts in the chat here. So thanks, Catherine. And Sandy is saying, having found the Facebook page and making new friends there has been a huge help to dealing with the pandemic and the disease. For sure, I spend a lot of time going through the Facebook page, and it's just great to see all the posts, and it really is a big family, and it's so much support and a great place to get a lot of information as well. I'm glad that that's been helpful. Any other? Oh. Love the Facebook page. I'm only about a year since diagnosis. That's Laura. Hi, Laura.
Yeah, I think especially during COVID, the online ways to connect have been incredibly helpful. Like just going back to what Joan was saying about Brooke's experience with conferences at first, I had exactly the same experience. My first conference was in 2013 and I was terrified. I didn't want to see people who were sick. It scared me a lot. I was envisioning this, like looking down the long tunnel, what was ahead of me, and I was so glad that I went. And the last couple of years, I think the online component has been so much more important. And thank you to PHA Canada. I think we've seen a lot more opportunities for online connections that are more coordinated, and being able to do the sort of amount of face-to-face that we can. We're all a lot more comfortable with Zoom now, but having those Zoom check-ins has been really helpful in just getting to know people, and then being able to really connect with people around the country too, or far away in the province that normally we wouldn't be able to.
Yeah,
I think that's key. Support groups are generally local support groups, and they're great. I love in-person support groups. I think they're fantastic. But I agree with Tarja. The meetups have given all of us, patients and caregivers, an opportunity to meet people. That's what I find conference is, an opportunity to meet people that I wouldn't necessarily be able to meet any other time, but we're all there with the same purpose at the same time. And Zoom meetups allow us to do the same thing. I've met so many really nice people. I've met so many new people through Zoom meetups that I wouldn't have met otherwise unless they and I attended conference. And it was even the same thing with this year's conference. I mean, that was I think the biggest thing that I loved about this year's conference was the ability, because you put us into different breakout rooms in the conference. Sometimes when you go to conference, you kind of migrate your way to some place that you feel comfortable, and being, I'll say, forced into a breakout room that you didn't choose moves you into places that you might not have otherwise chosen. And yet when you get there, you go, oh my gosh, I'm so glad I'm here. You just meet people that you would never have met if not for Zoom and if not for the conference.
With the added bonus that you can do it in your jammies.
And you can do it in your jammies.
That's such a good point, right? Instead of getting all dressed up and having to go to a conference location with bad food or good food or whatever it is.
Or stand, you can sit.
Yeah, that is a good point. Like, so the conferences are great, but they're often very, very long days, and it can be super taxing. And so being able to have these sort of 1 hour jaunts is brilliant.
Good. And like I said during the slides, staying connected was just overwhelming in the survey results. It was everywhere, in every kind of part of each question. When folks had a chance to talk about connections, it was always about how important that was, either within the PH community or just within family and friends. So I'm glad to hear that the meetups, we've been able to find ways to continue to allow the community to get together and meet up, so to speak, even though we've been stuck at home. So I'm glad that that's been working, and I can see more comments in the chat here about the meetups. Meetups are good, group sharing time. The bonus of our list is there is no name calling or poor attitudes towards each other. We're talking about the Facebook group. We have a great group for the support we give each other. Even sometimes we tease. And for sure, I think the group is very supportive, and you've all become such close friends that it's just like chatting with friends. A great way to reunite. And you can just see, even just through the chat, how important the staying connected piece is. That's sort of where we're all gravitating towards, is this opportunity, and just even to have this opportunity to chat today. is so important. And we are gearing up for, believe it or not, for a conference of next year. We've already started chatting and planning about that. So some of your comments are definitely helpful for our planning for that for next year, but that'll be really helpful for us for sure. Any last, oh, I see another question. Oh, I already answered that one. Any last comments, anything from the panel, anything you want to say before we wrap up?
I just want to say thank you. Thank you for the opportunity to be part of the survey committee. I really appreciate the work that was done by all of the committee members, and it was a really good, great group effort. Different perspectives. We had, I don't know what it was, 38 pages is what we started with in terms of questions, and we had to whittle that down to something that was supposed to take 15 minutes. And as hard as that was, I think we came up with a really good set of questions that were pretty much all encompassing.
I think so too. It's always hard. You always think about the questions you could have asked and should have asked, but I think the survey is great. And just on that, why for each of you, why was the development of the survey so important? Why now? And what about it was important to you? Why did you want to get involved?
I love hearing about patient experiences. I like talking, I talk to you guys one-on-one all the time, but not in an anonymous fashion. And obviously that impacts your level of honesty. And so for me, it's just having that capacity to hear, what you think without me knowing who you are. I think it's very useful.
I second that. I think the biggest thing about the survey is the patient experience and the patient voice.
Yeah, so important.
Yeah, I don't know that I could add anything to that. I'm a big nerd and I like research in general, but I think the patient voice piece is super important. I think what Lisa was talking about earlier, but often like the focus in the clinic is very clinical for good reason, but this is a space where we can talk about our quality of life in a more structured kind of way and bring it all together.
Okay, well, I'll leave it at that. I'm just going to double check that there's nothing else here. No.
Kimberly, can I hijack real quick before you wrap it up?
Yeah, for sure.
For all of my patients out here in BC, if any of you guys are having troubles accessing medications or care or anything like that because of the flooding or the supply shortage, please let us know sooner versus later. We have contingency plans in place for all of this stuff. But if you see or hear of somebody struggling, encourage them to contact the pulmonary hypertension clinic, please. Thank you so much. Sorry, Kimberly, go ahead.
No, that's fine. Thank you so much. That's so important.
Yeah.
Okay, well, I want to thank you all. Thank you again, panel. Thank you so much for all your work on the survey, and thank you for being with me today. And thank you all for coming. This has been recorded, so if you loved it so much and you want to watch it again, I'm sure we'll publish it somewhere on the website to do so. And thank you so much, and stay resilient. Bye, everyone.
Bye.
Bye.